Welcome to Vitals and Values. Today I am joined by a guest. It is my sister,
Hi.
Jana Battenberg. So we have a story today. This is a story about a radical shift that we had from maybe burnout to more personal care.
Or almost burnout, at least.
Yeah. And so David is sitting this one out, and this is going to be a story and a conversation between Jana and myself. You ready?
I'm ready. Let's go. Fantastic.
Okay, so we left traditional medicine.
We did. We left almost a year ago now. It's been almost a year.
And so where do you think that, where did it start?
What, the decision to make
Just
the
kind
shift?
of like, how did you get there?
I think the shift first happened when I got to my first big girl job with an outpatient primary care office here in Grand Rapids area.
Yeah, so we did medical school here in Grand Rapids. We went to Michigan State College of Human Medicine, which is located in Grand Rapids. We transitioned very easily to residency through one of the hospital systems here. And then that led to a very easy transition into a job with that same hospital system.
Yep. So it was a nice, easy pathway, and it was exactly what I thought that I wanted to do. I thought, I'll stay in Grand Rapids, I'll be taken care of, I don't have to think about anything other than doing medicine and seeing patients, and life will be good.
She thought, okay, so I have made it. That's it.
Yeah. I mean, I've been very good at following the rules and doing what I guess is expected. So if you decide you want to go to med school, you go to med school, and then you decide what residency you want to go to. So you apply and you get in, and then you find a nice job after that. And you're told that things will go well and you're going to have a rewarding, fulfilling career.
And when do you feel like you started noticing that you weren't necessarily happy with this?
Probably 2 years in to my job. Because let's just be honest, COVID happened 6 months in. So that was a big detour. So I don't know how things would have been had COVID not happened.
And I think both of us have heard from physicians that were working well before COVID that COVID seemed to kind of be this very critical point where a lot of things in medicine in general, I think, the problems were almost amplified in some sense.
They were there before, but I think we became more aware of them, or they became just more obvious. Things changed. At least that's what I hear. But my head had been down prior to that, going to school, doing residency. So I can't say I noticed a shift, but yes, I agree. That's what I've heard.
Okay, so 2 years in, what kind of things were you starting to notice or feel?
I mean, what I remember most distinctly is patients coming in and asking for help with maybe solutions to their problems that were things I didn't learn in med school.
Yeah.
So well, what supplements should I take? What do you think of these? I don't want to take a medication. What else can I do? And I was kind of a deer caught in the headlights because I don't have an answer to that. I learned about medication and how to prescribe.
People, if you go to your doctor and ask them about supplements, the vast majority of doctors have literally no idea. Yeah. It would be that's my experience anyway.
And I've done additional training now, and I still can't say I'm an expert.
Okay, so so you did it was like a summer program between the first and second year of medical school, right?
Yes. Let's go way back to medical school. Yes, between my first and second year, I went out to the Portland, Oregon area, and I volunteered or did an internship, whatever you want to say, at an underserved health clinic. And I was housed with a physician who lived in that area, and she was in the process of doing a fellowship at the University of Arizona through their Andrew Weil Center for Integrative Medicine. So she told me about that, and I heard about it.
Was she studying at the time, or?
I don't know if she was studying, but she just told me about it and the fact that she had to go to Arizona a few times for it, and I didn't think much of it, but it stuck in my mind.
And so I remember us talking about doing something.
At that time, you mean?
Later. So this 2 year into our practice, then we were I can't remember. Was it we wanted to do more for our patients? I don't even remember specifically how the conversation started.
I think it was, yeah, we want to do more or be able to provide answers to the questions that a lot of patients had that the traditional system didn't have, or just traditional medicine didn't have an answer to.
And so through these discussions we had together, this
We
like
looked up the
the
fellowship.
fellowship came up. You remembered that. It
did.
stuck in your head.
It did.
And so I remember like I think it was like dark November night. I just remember sitting on the couch with you and
Looking
we were
it up.
looking this up and we're like, well, it's kind of expensive, but like we could do it. Like,
Yeah, and
why don't we just do it?
It was like 2 years, but I guess
why
we can do
not?
it. What's our school? I mean, I've done tons of school up to this point. What's another
Yeah, so we
years?
went for it.
Yep,
We applied.
signed up.
I mean, it wasn't like hard
Yeah.
to get in, but
Yeah, applied, got accepted, went through all the whatever pre-enrollment paperwork stuff, and then started. I think that program was like January of 2022. Yes,
Yeah.
2022. Yep.
So we did that, and it was mainly online modules,
A
reading
lot of
things, watching
reading.
videos. There was quizzes.
Yep.
There was a few projects, a few small group things.
Yeah, virtual small groups, but going through all sorts of types of integrative medicine. So integrative medicine tries to look at the person holistically, the patient holistically, and address diseases and symptoms using all types of medical modalities. So that includes traditional medicine and medication, but it also looks at supplements and traditional Chinese medicine and acupuncture and chiropractor and homeopathy and nutrition and exercise. And how can that all come together into one complete package to treat the person as a whole person, body, mind, and spirit.
Right. And I think it's useful to be like, okay, so there are answers in traditional medicine, but there are also questions in traditional medicine.
There's a lot of not answers in traditional medicine.
And so when, how many times you get the patients who are, I feel bad, I feel crummy.
Something's wrong.
Yeah, and you do the labs and they're all normal.
And maybe you do some imaging
and
it's all normal.
And those are the kind of patients where it's like, well, what are we going to do for these people? Because the basic lab tests and imaging tests and so forth in traditional system just aren't providing them the answer. So with integrative medicine, we're exploring outside of that a little bit. And I liked the program because it really still tried to use the most evidence possible for these modalities. Like it looked into the research, it looked into the evidence. And for some things, there's pretty decent research. And for other things, there's not. But doesn't mean you can't try things.
Doesn't mean you can't try it. Just know what the strength of evidence is so that we could better educate our patients on, we can try these things. How much benefit you're going to get? Well, I don't necessarily know, but if traditional medicine didn't have that answer and I would otherwise have to tell you, sorry, I have nothing else to offer. Well, then this is something to offer, because that is one thing I try incredibly hard not to do, is say, there's nothing more I can do for you.
Yeah.
Because that's just not helpful, and it shuts the door and ends the conversation, and patients feel unheard.
The relationship
is over, yes. And that's not a way to care for a person.
Yeah. So that was kind of, I feel like that decision to do the fellowship was kind of a step.
Yes. I feel like it was like the first step in the direction of, I want to do something different.
But like, we didn't think at the time that meant we were going to like change our careers or jobs.
Absolutely not.
It was just like, this will be a good supplement. It'll give me more education.
But I feel more empowered and be able to empower my patients.
But I remember, so we had to go to Arizona for a few times throughout the
program.
Over
those 2 years.
And I remember one of the lectures we had when we were in Arizona was different integrative providers who had started their own businesses doing something else.
Just something else.
And it was a variety of different types of businesses. But I feel like we both, looking back, that was kind of like you don't have to stay doing the exact same thing that everyone else is doing in medicine and what you thought you were going to be doing in medicine. Yeah. You could actually change.
Yeah. So we weren't following that. We were trying to get outside of that traditional path with blinders on, using just medication. And then that opened our eyes, I think, to the fact that you don't have to also stay in this traditional path within your career. You can do something different.
So I think when you go to med school and you follow all those rules, I think you're told this is the way. Don't question it.
Yeah.
I feel that way.
I mean, looking back, I certainly think that's true. It's not like it was said in those words. But I'm very good at following rules. I'm good. You tell me what to do. I will follow those rules. I will do it, and I will do it as best I can. And so that's what I did until I realized that wasn't what I wanted.
So it was while we were in our fellowship that this whole idea of changing to a different type of medicine kind of started. And I don't remember, honestly, like our first conversation. I don't know how we got to the topic of concierge medicine, but we were looking for a way we could do medicine, do our job, treat patients differently. And I remember we were looking at like, is there something we could do online? And that became, I think, evident fairly quickly that if we wanted to be primary care doctors, that was going to be challenging.
Yeah, because that is what we went to school for. That's what I wanted to do, and that's what I got trained in. And I think there's so much you can do within primary care. And if we didn't stick with that path to some capacity, then I felt like I was throwing away all of the education I had.
Yeah.
And I wasn't willing to do that. I feel like God led me down that path for a reason. And so I wasn't going to just then turn around and say, well, too bad I don't want that anymore. Let me do something on my own.
Plus, what else would you do?
No idea.
Exactly.
I mean, I'd be happy to go back to school, honestly. I probably would have been fine with that, but finances are important too.
Yeah, there's those
loans
student
to
loans
pay.
still, right? So, okay, so we did the fellowship. We were starting to think about different options
For our careers.
and I'm trying to think. When did we first hear of concierge med? I don't know.
So I think this summer of 2023, we started, I think, more aggressively just meeting with people to get ideas about different career paths.
Oh, and I think it was that summer. We were talking, so we have a friend who has a small business, and we met some of his other friends, and he had been like, "Oh, you guys should meet. You'd really get along."
Yeah.
And we started talking to this woman, and she said to us something about, well, the business you are going to start. Like, we had told her we were going to start a business, and she was like continuing that conversation.
She wanted to help us with that business, which we had never verbalized that we were starting a
I was
business.
like, wait a minute, what do you mean the business we're going to start? Like,
Yeah, what business?
What business? And I feel like that happened another time too.
I think it did.
It was
I
like,
don't think it was only that
Yeah.
person.
And then, so that I think we took note of that, and we're
Yeah.
like, well, hey,
Are we being nudged down a path?
Yeah, and I feel like looking back now, we think like, hey, this was kind of God like saying, this is what you're going to do.
Yeah.
This is it. I'm telling you right now.
Yes. You may not see it right this second, and maybe you didn't want that, because I think we both remember very specifically saying we will never start a business.
Absolutely not.
And we will never practice medicine together.
Nope. And
But
God had other plans.
God had other plans, yes.
And then I remember, okay, so I talked to a endocrinologist in town who had started her own practice. She had left the system and was doing independent practice. And I was like, I'm going to go talk to her. And she told me I should really connect with, reach out to Dr. Lori Burkholtz, who is a physician, family medicine physician in Holland, Michigan, and she had started her own concierge medicine practice. And I was like, oh, okay. And I mean, it took a few months, but I think you ended up emailing her and met with her.
That was the fall. It was either November or December of 23. I drove out to Holland to meet with Lori. Now, at that time, it was not in my head at all to start a concierge practice. I just was interested in talking with her about why she had left the traditional system and what what her goals had been, so that we could talk about what we wanted to do. But yes, it wasn't like, oh, I want to start concierge practice, I'm going to go talk to our concierge physician.
Yes, you had that conversation, and that was essentially it, I feel like, at that time.
It was, but while we were talking, while I was at her office talking, I mean, I think rightfully so, I never said exactly why I was there. She was assuming, at least that's the impression I got, she was assuming that I wanted to start a concierge practice. That's just how she was talking to me, explaining how she did it, and that maybe I should contact the company that she had used to start help her practice, or to start open her practice.
And so, like, we didn't do that right away.
Not right away.
I can't remember. You reached out to her then again later, I think.
It was a few months later. I think, somewhere in between meeting her and later in the winter or early spring of 24. I guess this would be 23. I don't know, whatever date it was. The early spring of that next year. I think we actually had started thinking about concierge. When I came back from meeting her, I think I started looking into it because I said, you know what, she did this.
Why couldn't you?
Why can't we? This could be a good option to continue to use our degrees and our passions in a different way.
Yeah. And I think then we started, there are several different companies out there that help physicians start concierge practices. And so we had some conversations with a few of them.
I talked to a couple of them.
And then you reached back out to Lori with specific questions about her practice. And she was like, well, why don't you talk to my company? Because she was one of these companies to start a practice. So she was a company out of Cincinnati called Ms. Medicine, which is one of these practices or these businesses that help physicians start practices, but it is highly focused on women's health. It's passionate about women's health
and providing care to women because they're underserved in a lot of ways in medicine.
And so we started the conversation with them, and we just really loved the people with Miss Medicine. Shout out to Amy and Lisa.
Amy first. It was very funny. So we contacted Ms. Medicine, and they got us in contact with Amy, who is part of the recruitment team there, I believe. And Amy lives in Pennsylvania, so she's not in state. But we were trying to come up with a time to have a conversation with her. And funny enough, found out that she was going to be in Traverse City, Michigan, the same time we were going to be in Traverse City, Michigan that summer. So we actually met her for the first time in person at her brother's brewery in Traverse City. So
that was fun.
That was fun. And I think, it's not like that's telling you that, yes, this is the right fit, but it's just a lot of reinforcement that this pathway seems to be working out well.
And pointing you towards that direction.
Yeah, it was just positive reinforcement that we're going on the right path.
And some of the other companies we talked to were like, meh, like
they were fine. But I didn't really get any sort of good vibes or
just like
I have to work with them. Yeah.
And we really clicked with Amy. We loved what they were doing at Ms. Medicine. And so we started the process of working with them.
Yep.
And so I think this was like, I think we met Amy August of 2023.
Yeah,
and then
off for a year,
we started working with them the end of that year, I think, and then spent 2024 trying to work on
the whole
how do you open a practice. Yep. And so they were very helpful in telling us like the steps to do that, the timeline you should be doing things in.
When you need to find a building, and you need to start renovations if you need to build something out, and how do you get all your insurances up to date? Make sure your licensure is right, and all the stuff I never thought about because I didn't need to.
Yeah, and a lot of business things, which we obviously, as being trained in medicine, had no experience in, and so they were very helpful. And we worked through that process through early 2024 into the summer, and finally left our jobs at the hospital system in August of 2024. And then we opened our practice September 2025.
24.
2024.
That's still 2024.
That's right. And so now it's been, like you said, almost a year.
Almost a year since we left, and coming close to a year since this practice has started.
Which is awesome. And having had this practice for the past year, like what are the first things that come to mind when you think about, hey, I did this?
My first thought is, I'm so glad I did this.
Absolutely. Why?
So I no longer am exhausted at the end of the day. I no longer dread Mondays and going back to work. I mean, I like the weekends, so I'm always sad they're over.
Because they're fun.
But I'm excited to go to work. Every day is different. I like wearing all different hats at work. So I'm not just seeing patients. I also get to do some marketing and some networking and practice management even. I just like having my hands in a lot of different pots. It's kind of fun, and I think it just keeps my brain more occupied and utilizes a lot of different skills, which has been great.
I think both of us felt like in the system medicine, we felt like we were placed in an office. This is the job you do. You see 20 patients or whatever a day, and this is what you're going to do for the next 40 years of your life. Don't ask questions, and not much ever changes. And at least I didn't feel my voice was ever heard.
Oh, absolutely not.
So I stopped bothering.
And there's no room for growth.
No room
for growth.
No one, I remember, I went to my first, we had to lead physician at each practice. And so we had a annual review. And so the first review I had, I'm like, okay, this will be good. I'm a brand new physician. I haven't been in practice as an attending for a year even. And I asked this lead physician, I said, well, what can I do to improve? What things do you see that I could work on? And he goes, oh, you're doing fine. I think everything's great. And that was literally it. And I'm like, that's not true.
It's not true.
I
And
mean,
it's not helpful.
It's not true. It's not helpful. There's no constructive feedback. And I'm like, how the heck am I supposed to get better? How am I going to improve my skills? Like, if there's no feedback and no one really cares.
No. And I mean, nothing against him, but I mean, it's not like he's watching you either.
No, he's got his own job.
He doesn't know what you're doing.
He
So
doesn't have
how would
patience.
he be able to give much feedback? Because you're kind of working in isolation. You have a lot of colleagues and you work in a
Around
big
you.
office. You have a lot of colleagues around you, but you're all working independently. And at least that's how my office was. Everyone's head is down. They're doing their job and they're just trying to survive. And that doesn't foster a lot of collaboration or camaraderie. And it's maybe miserable is a strong word, but it's headed that direction.
No, because I didn't I didn't like going to work every day.
No.
I wouldn't say I hated it, but I did not enjoy it.
And as we walk through this process, I realized that, there was no way I'm going to do that for 30 more years.
So, I mean, people talk about burnout a lot in jobs, right? So burnout is like the combination of exhaustion, cynicism, compassion fatigue, like apathy, and like reduced accomplishment. Like you just don't feel like, well, you don't even care
doing anything. Yeah.
And do you feel like burnout could be something that you were dealing with at that time?
I think yes. I don't know if I'd say like full blown burnout, but I definitely felt a lot of those. And if I wasn't fully burned out when I left, I certainly was headed that direction.
Why, Because I was always tired.
Sure.
And I would come home from work just like, I was like, how do people do things after work? Like, I have no energy to go out for dinner, to meet up with friends. Like, I just
want to go to bed.
Yeah, I was like,
eat dinner and go to bed.
I was like, doesn't everyone feel this way? And then since we opened this,
I realized
completely. My sleep is poor. Like, I got way more energy.
You want to do things, right? You're excited to go out after work and have fun.
Yeah, I go out for dinner. I go golfing. Like, I can do those things, and I don't feel like I'm gonna die.
So I would say I had some fatigue too, not necessarily extreme, but fatigue. I think one of the biggest things that looking back I noticed was the compassion fatigue. True. You
just don't care.
You just don't care. I mean, you do to a point for your patients and you want them to be healthy, but you just don't have the energy to care that much about everyone's problem because you can't. When you have over 2,000 or over 3,000 patients that you're getting bombarded with questions and labs and consult notes and hospital follow-ups and ED notes, and you just can't care because it will burn you out.
Yeah, if a patient leaves, you're like, oh well, there'll be another one. Kind of.
And sometimes you're like, oh good, that patient left.
Or that.
Which we don't feel about now. In our current practice.
No.
We love our patients. They're all great. And I don't want any of them to leave.
Nope. And so burnout's always this term, but then in medicine, I've heard, and maybe it's other fields too, I don't know, but the concept of not burnout, but moral injury. Have you heard that?
I've heard the term, but I can't remember exactly what it is.
So moral injury is distress when you're forced to act against a deeply held moral belief. So in healthcare, it is often due to the systemic pressures of the system. And I don't know, I heard that not that long ago. And I was like, I do really feel like that's so true for how I practice.
In what way?
Because like your beliefs of like how you want to practice medicine, how you want to treat people, how you feel they should be treated.
Your idealistic
goals.
Like when you first start.
Right. Like, well, just like treating patients how you feel they should be treated, like spending time with them, like listening to their stories, getting to know them, like looking them in the eye, like
not staring at the computer.
Types of things. Like in this moral injury concept, you're not able to do that because of the system, the pressures around you that you have no control over. And so I think a lot of what makes medicine hard today is that lack of control in this large system where we said, like, we did this job, but nobody really cared. Nobody listened to you. I didn't feel like anyone hadn't, like, if my opinion didn't matter.
And like from a control standpoint, I mean, in some aspects, yes, as a physician, you have a lot of control about what you do with each patient. You can decide exactly what you want to do. But at the same time, you're limited within that structure of like rushing people through 5-minute visits. And so maybe there's this perception that you have control when in fact you're being constrained by the system. Yeah. So in fact, you don't have as much control as you think.
And I think that physicians they're not encouraged to think differently in like how we did it now and moving to concierge medicine. Like I feel like I've said this to you before. I felt like it was like you're stuck in this they put these blinders on you and they're like, this is the way it's done.
Mm-hmm.
And like, they don't want you to like look outside of that. It's like, this is it. Don't question things. Just do this job and you'll be fine.
Yeah. Or it's like you have a bit in your mouth and maybe you
Yeah.
don't realize it, but you're getting pulled in one direction, even though you might want to go the other way, but you just can't because you're getting pulled by that bit and you can't get rid of it.
So when you start seeing beyond that, it's like, oh, there is something different. Now, it's scary. It's hard. It's work. But
There's no guarantees.
no. I think I told you that when we were in the process of doing this, I was talking to a friend and he said to me, explaining it, well, it's kind of scary to do all this. I don't know. And he said, well, I think what would be more scary is to not do it. And I was like, that is so true.
Scary to be stuck in that hamster wheel of a system
And look back 40 years from
burned
now.
out. And yeah, looking back in 40 years and saying, what just happened? What did
My
I do
life
with the
went
last
by.
40 years?
So, I have a little quiz for you.
Oh.
On
what?
So we were talking about like these problems that in the traditional system that we felt. And so I just think this is interesting.
Okay.
So this is in reference to medicine in the healthcare system, the larger system that we had been practicing in. So this is all based on research. What is the average time that a PCP, primary care physician, spends with their patient?
6 minutes.
So I was actually surprised that it's higher.
It's just primary care.
Yeah. So it's about 15 to 18 minutes, which you might be like, oh, that's more than I thought. But the thing is, so for 15-minute appointments, most of them are shorter. Like most of the 15-minute appointments are much shorter, and people get rushed through them. Whereas I guess the 30-minute appointments are shorter too, but like people spend a lot more time or can spend more time in the 30-minute appointments than in the 15-minute appointments. So it kind of averages into 15 to 18. But most of the 15-minute appointments are shorter, like 6 or 7 minutes.
I guess I'm just cynical.
Yeah. So, okay. That was the first one. What is the average percentage of time in a day that a physician's working that they spend on the computer or in the electronic health record?
The percentage of their day?
Yeah, like if they have an 8-hour day, like what
more than 50%.
So it's about 50%.
Okay.
So about 50% of your physician's time is spent staring at a computer, not seeing patients. Does that
include staring at a computer in the room with the patient?
I don't know the answer to that.
Because if it's not, then the percentage is way higher.
Could be. Okay, this was like, I remember hearing when this study came out, and it was just kind of interesting. The estimated time that a primary care physician would need in hours to provide all the guideline recommended care. So for people that aren't in medicine, there's all these guidelines that
standards of care
that like you have to do this, you have to do this, you have to do this. Like you're supposed to cover all these things. And if you actually went through all those guidelines and did them all, how much time would you need?
I think I've seen this, and I think it's more than 24 hours in a day.
Yep. It's 27 hours.
27 hours a day.
Oh, that is what your primary care physicians are fighting against.
So they're doing their best to do some of that, but they certainly can't do all of it.
So it's pretty fascinating. All right. What is the average patient panel size in a primary care office?
22,000.
Yeah. It said this varies quite a bit because I think you have to take into consideration that some people work part-time.
Yeah.
But it seemed to be about 2,500 patients.
Okay.
So I know when I was when I was working in the system, I had over 3,000 patients on my panel, and I don't know where you were at. Was it close to that?
I wasn't up to 3,000. I think it was a little over 2,000. Yeah.
And so you just think, you have 3,000 patients, and they can all personally message you, and like essentially it's like an email, right? So they can personally message you whenever they want. You're also getting their lab results into your email system. They're in the electronic medical record.
Whether or not you ordered them.
Yep. Yeah. Oh, yeah. They all come in there. You're getting so their labs. You're getting their imaging results. You're getting all the notes from any referral that you send them to. If they go to the ER, you get about 5 notes. I don't know why. It's like they were there. Here's what happened. Here's another thing that happened, and then they got discharged. So you get 5 notes, and so you have to sift through all of this for 3,000 patients.
And you have to do something with it. You can't just ignore it.
No, you have. And I mean, I worked really hard to respond to all my patient messages. I have people that I worked with that had hundreds of patient messages sitting there that they never responded to.
Because it's almost impossible.
It is so hard.
And if you miss an abnormal lab result, it's like, well, yeah, because Sorry,
one
I was
among
trying
many.
my best. Yeah.
And so that's why the physician is spending so much time on their computer, because they're doing that in addition to seeing patients and trying to help their patients. So I know when I was seeing patients in the healthcare system before concierge medicine, when I'd be with a patient, often all I'd be doing is thinking about the next patient.
Mhm.
I'd be like, are they here yet? What are they coming in for?
You're
Are
not
they here?
focused
Yeah,
at all.
you're not focused. It was very challenging.
Yeah, I mean, you can try your best, but you just can't help it.
Yeah, because you got to move.
And I mean, I don't think I ever didn't work through lunch.
Oh no. If we had like a
Staff
a
meeting?
staff meeting, or no, I was thinking like a holiday party or something. I was
Yeah.
like, I don't got time for that. I
No,
would like quick show up and then I would book it.
Because the problem is if you don't work through lunch, you're just going to have to stay longer at the end of the day, and then you get home at 9 p.m. Yeah.
And then final quiz question. What percent of primary care physicians report burnout?
40.
51%. It looks like that number has changed since COVID kind of dramatically. It looked like it popped up.
From what? Do you know?
I don't remember what it was, but so that was my quiz for you. Solid work.
Wonderful.
Jana has always been an excellent test taker, and I think
I like tests.
she did very well. All right, so concierge medicine, I did not know this, but so people have asked me, like, I've never heard about concierge medicine. Is it new? So actually, the first concierge medicine practice started, did I tell you this yet?
You said 96,
Yeah,
right?
so 1996. It was started in like Seattle, Washington area. Said the annual fee. Oh, we haven't even like actually told people what concierge medicine is, so we should probably do that.
We should do that.
Well, so in concierge medicine, I mean, we'll get to more details, but there is an annual fee that is a part of this model.
A cash out of pocket, not covered by insurance fee.
These initial practices in this area, there was 2 of them, and they charged per year. In 1996, one of them charged $13,000 a year.
A person?
Yep, and the other was or $20,000 a family.
That's crazy.
So
people were paying it.
Yeah, people were paying it because
it works, apparently.
Oh, Jana, what do you tell people? What is concierge medicine? This thing we've been talking about that we started doing.
The goal of concierge medicine is to provide better care to our patients. I mean, really, that's the thing. And in order to do that, we have to get outside of the traditional insurance payer model. So concierge practices typically don't bill insurance for their services. So in order to survive as a business, we have to have income from a different way. And that way is charging an annual membership fee, or people might call it a retainer fee, or some sort of cash fee that I guess allows patients to be members of the practice. And so with that freedom of not billing insurance for our services, we are able to provide the care that we weren't able to provide previously at our other jobs, kind of what we've been talking about. And that includes the appointment times. So we said how short appointments typically are. Well, with concierge medicine, because we're doing it our way, we can spend more time with patients. So we have appointments up to 90 minutes long.
I think most of ours, unless it's like hey, I had a cold.
Yeah, but yeah, they can be long. So you can actually listen to the patient and get the history and dive into what's going on. So longer appointments, because we do this model, we also have a smaller panel size. So instead of seeing 2,000 or 3,000 patients, or having 2,000 or 3,000 patients, we have 200 or 300, let's say. Every practice is different. So because of that, we are not overwhelmed with all of the information that comes in from each patient, and we're better able to focus on each patient's
patient.
Yep. And then because we have smaller patient panels, we have more access. So patients don't have to wait weeks or sometimes months to come in for an appointment. We can get them in that week, hopefully same day or next day, if schedules work out. So patients don't have to wonder what's going on or just go to an urgent care.
So it prioritizes quality of care.
Quality, yep.
It's personalized. There's a relationship piece, which some people really want that. Some people probably haven't thought about it, but a relationship with your doctor actually makes a big difference in the kind of care that you get.
Yeah.
When they actually know you, they understand you, you've had multiple conversations, like they can care for you better. And
not only better care, it's less frustrating for you too as a patient, because you don't have to explain yourself 1,000 times to the nurse or a new provider or a PA that is working in the office. There's no question. They know you and they can answer your question right away.
And most concierge practices have a direct access, the patients have direct access to their physician. And
Yeah.
so
Some capacity.
either through a phone number, like they give you a phone number, or they can text you. So we have, I think the majority of our patients, when they need to get a hold of us urgently, can text us. And patients do that when they need to. And I think majority of patients do not abuse that. It's not like we're being bombarded with texts all evening. And so it's a great, easy way for most people to get a hold of us if they need us. Patients, when they call too, there's not like a massive
phone tree
that they have to sit through. They really get to know our office staff. And so they feel like they're a part of
it's a family. Yeah, it's our family.
I don't know. We've had multiple patients since we've opened who have said, I'm never going back to what I was doing before. So kind of like we feel in practicing medicine, patients feel that way too when they come here. They feel the difference. So anything else that you think is important to what concierge medicine is?
I think those are the kind of the baseline, the important things. Not every practice is set up differently. They all have different membership fees, and those membership fees may include different services. So you do have to ask each practice, if you're considering joining one, what exactly is included. So
I think the transparency is generally there.
Yes, absolutely.
And we have different, like, I think one thing that we both really liked about starting this practice is that there's a lot of new things coming in medicine, like technology, AI, different, there's so much. Medicine's changed all the time. And I have felt like I've been able to really learn about a lot of the new things and really stay up on what's coming and what can help our patients. So
it can definitely be more cutting edge.
Yeah. And so there's a lot of really cool different like genetic testing options that we can offer our patients, some more advanced cardiac testing, there's
imaging,
cancer screenings, advanced imaging. And we've met so many cool people.
Yes.
I mean, we have gone to different specialist office. They've come here. We've met with 1 million physical therapists who are chiropractors, therapists. Like you meet
medical companies.
Yeah. And so you meet all these people and you really form this kind of group that you this network that you can trust. And you're like, I can refer a patient to so-and-so because I know them. I have their phone number. I can get them in quickly because I can contact the provider right away.
Like I specifically decide who I think would be the best fit when I'm referring a patient out. Whereas my previous job, the referral coordinator did that.
Yeah, it was always within that system.
It was always in the system, and I didn't have time to think about who I wanted the patient to see. So it really wasn't up to me, and the patient got whoever. Yeah. And now we can personalize
it. And there's 3 big hospital systems in our city. And I still refer people there. Like they still have great resources and physicians. But there's a lot of other private offices that I didn't know existed that now, like the PMR doctor's wife is at his front desk and our front desk staff communicate and they talk about their lives. And it's like, it's really cool.
You do, you it's that network and almost, you're all on the same team because you're doing something different. You're not in some of them are still billing insurance and doing the traditional model, but they're not within this larger healthcare system that ties their hands.
Okay, question. Yeah. You said early on that, so we went to med school. We did not get MBAs.
No.
Right?
No.
So our business knowledge was very like we're amateurs, right?
Very novice, yes.
But we love to learn.
Yes, we do.
We love growth. We're very growth minded. And so what was the biggest business challenge you think you've had so far?
I think probably marketing.
That's always my answer.
I think that's what you were going to say too.
Because I know for me, I think marketing, I'm like, can't someone just tell me what the right thing to do is? And it's like, it's not that easy. I realize and I've learned that. And it's like
and what worked for one person may not work for you.
And you have to try things and
it's expensive
and it costs money. And so learning marketing and actually how it works has been the hardest part, but also really interesting because it's been so challenging. I feel like I've started learning a lot more about it.
And I want to know and I want it to be better. Yeah.
So that was one challenge. Anything that surprised you about business?
About business? To be honest, I don't think I really thought that hard about it jumping in. I just jumped in. What about you?
Well, I was just thinking that like I didn't know when we started, but I didn't know if I would even like it.
That's true.
Like, well, I like owning a business.
But to be fair, honestly, the same thing is true about medicine.
That is true too.
You spend a lot of time and a lot of money going to school for medicine, but you don't know if you're going to like it.
And you sometimes get really far in before you discover you don't.
And that's unfortunate.
But I think both of us, I think we were talking about this the other day, that we both really enjoy the business side of this.
I do, yeah. I think I like I just like the breadth of knowledge and growth within that I'm able
There's like
to
different pieces to your
work on.
day.
Yeah.
Yeah, because I mean, we love seeing our patients, right?
Mhm.
But for anyone that's been in medicine, you know that to just see patients every day, it can be
Do nothing else.
exhausting.
It is.
And so it is very nice to have your day broken up by different tasks that aren't patient care related.
Mhm.
At least that's how we feel. Maybe other physicians don't feel that way, but
Yeah.
that's
And that's fine.
they're probably not starting businesses, so that's
Yes.
fine because we're all different.
Yeah.
Because this is not a dig against anyone that stays in the traditional system.
No, absolutely
If you
not.
are doing great care there,
And you enjoy your job and feel fulfilled.
yep, and you feel like that's where you're called, awesome. We just
It
did
would
not
have
feel
been,
that way.
yeah, and it would have been a lot easier to stay there.
In some sense, yes. Oh, what critiques do you hear about concierge medicine or misunderstandings?
I mean, the biggest one is that it's only for the rich people because the rest of the world can't afford it.
What's your argument against that? Or what do you think?
So I understand that not everyone can afford concierge medicine. That's absolutely true. It is somewhat exclusive from that standpoint. However, there are a lot of people out there that think they can't afford it, that actually could if they prioritize their money in a different way. So it really comes down to, I think, your priorities and your willingness to spend money on something that we've been, I think, brainwashed into thinking we should not spend money on, or it should be paid for by someone else.
Your health is, I don't know, probably one of your biggest assets. Like,
yeah.
And why are we trying to nickel and dime it, right?
And spend as little as possible and do as little as possible to, I guess, just maintain status quo.
So you may have health insurance. We encourage all of our patients to
I
have
think health insurance is great. Yeah,
there's nothing wrong with it, but health insurance is not going to cover everything.
Nope. And you know, depending on your perspective,
yes,
you may have different view, but I don't think it should cover everything. That's not what insurance is for. I mean, that's what car insurance doesn't pay for your oil change.
Nope. I always use that as an example. Like, you get car insurance, you still, every time I go to the mechanic, I pay them. I expect that, right?
And I have to fill it with gas and I have to pay for that every time.
And I think there's a lot of different experts, professional experts in different fields. So we have lawyers to help you with your legal advice. You have financial advisors who help you with your finances. You think, oh, you have accountants to help you with your accounting and stuff. You're like, I need these people because I don't know how to do this. I need the help. They're experts. I pay them. But for some reason in medicine, it's sometimes like looked down upon as like, oh, we shouldn't do that. Which I don't know. I know there are people that think that physicians should not be doing that.
And that it's a different type of career.
That we have this moral, ethical obligation to just the patient.
To put our patients completely first all the time. And if it burns you out and causes you health problems and other issues, then that's just, so be it.
And I don't think people actually would say that out loud, but I feel like they're like, we got to find a different way. And I'm like, well, we have found a different way. And this is the way that we think we are going to be able to treat our patients how they should be treated, and as a career that's sustainable for us. And I think, do you want a happy physician? Do you want a physician that loves what they do, that enjoys going to work, that's like excited to learn more about medicine? That's what you have in a concierge medicine doctor.
And I've also heard critiques that, you know, because we have smaller patient panels in concierge medicine, that fewer people are getting the care they need, that we're putting more strain on the primary care shortage. My argument to that would be, if I wasn't doing this, I would have quit medicine. And so I wouldn't be seeing any patients. So I can either see my 300 and provide excellent care to them, or I can see none. And I don't think there's anything wrong with that.
Yeah, there's systemic problems in medicine that I can't fix. So I'm going to work my hardest for the patients that are mine and do my best job for them.
In my community, in my city, at my practice.
So one of our influences in becoming a physician was our grandfather. So he was a family medicine physician in rural Iowa back in the 50s,
60s,
70s.
He retired in the 90s. Yep.
So he was the small town family doctor when he started his own practice in Pella, Iowa, and he was the only wasn't he the only
Initially,
doctor?
he was the only
He
physician.
was literally the only doctor. I think he said he like went to the bank and asked for a loan for like $2,000 or something to open the practice, and the bank denied him. And
Did they really?
yeah, the bank denied him, and then like somebody in the community like gave him a
Helped.
loan, or I don't know, something like that.
Mhm.
So that's how he started, and he loved what he did.
Mhm.
He was that like on call, always there delivering everybody's baby. He was that type of family medicine physician.
Never saw his family either.
Well, he was gone a lot.
He was gone a lot.
But he loved what he did, and he really valued his patients in medicine. And by the time we got into medicine, there was definitely a shift in that. We feel like coming into concierge medicine now, we're kind of bringing back a little bit of that old-fashioned medicine that Grandpa Van Zee kind of inspired us to do.
Yes, that relational care, really how I think it should be. But we've gone so far the other direction for countless reasons. But this is one way, we can bring it back to that feel.
Cool. What are some things that your patients here you think are surprised by? What do they tell you? Like, wow.
I think they're surprised by how quickly we respond to their questions or concerns. Yeah. We get back to them, ASAP.
I think they're surprised by the ease of communication with us.
Yep.
Sometimes if you call us, sometimes we answer the phone.
Yeah.
And I had a patient who was like, oh my gosh, this is so cool that you're answering the phone.
Yep.
So that's kind of cool. I think they're also just surprised at how much we do for them. So I know earlier this week, because you've had a couple of different patients ask about specific types of testing.
More functional medicine type
a little bit of a functional type, which we are not functional medicine doctors. Some people, I don't know why, think we are. We are not. But patients will ask about these tests that are often ordered by functional medicine doctors, and you spent a lot of time talking to different lab companies, having meetings with them, learning about what they do, understanding the results, because you've had patients bring these results to you that another doctor ordered. And it's that kind of care that we want to provide. Like, I want to do that for my patients.
I want, if it's important to you or there's some reason you want this test, well, let me learn about it. Let me figure out what the benefits may be to getting this test done, what the results may show us, and then we can have a better conversation about whether or not it's a good thing or it's a good test to order for you.
Yeah, and you can have that. You can talk about the pros and the cons, and we really try to collaborate with our patients through that mutual understanding to say, hey, is this going to be a good idea?
Yeah. I'm not going to tell my patients what they should do. I can recommend things. I can tell them what the standard of care is. But in the end, it's their health and their body. I just want them to be as informed as they can be so they can make the best decision for themselves.
Yep. I think most patients love that.
Yeah.
So cool. Any takeaways you want people to get about concierge medicine?
I think they should know that it's great, and they should all do it. They should all join a concierge practice.
And it's for everybody.
It is. It absolutely is. There's different practices around, and I think finding out who would be the best fit for you is important because you are spending money on this. So go ahead and interview doctors. If this is something you want to do, then talk to multiple options and see what would be right for you.
So we offer, which most of our patients do before they become patients, is a complimentary free meet and greet. So they sit down with you or myself, and we just have a conversation about, hey, who we are, what we do, why we do it, and then
what concierge medicine
is, kind of a shorter version of what we're doing right now. And then we see what they're looking for, and we say, hey, is this going to be a good fit? And we decide, is this something that they're interested in signing up for?
Yeah. So we don't want people to regret signing up, to regret spending the money. I don't want them to feel that way. I want them to be confident that they're making the right choice for themselves and for their health. And so come interview us, come find out what we're about, and if we have a good rapport, and then we can move forward.
Yep. And if you're a physician out there and you're wondering about concierge medicine, go talk to people. That's what we did. And we shout out Lori Burkholz. We talk about Greg Stemke is another concierge medicine doctor. Emily Collins, the endocrinologist. Those are the type of people that were they helped us get to where we are now.
They were willing to take the time to tell us their story
Mhm.
and give us their perspective. And so we want to be able to give back. So if anyone does have questions and wants to talk to someone about our experience and what might be right for them, we are more than happy to talk to them.
And if you're wondering about doing it, becoming a concierge doctor,
Mhm.
you can.
Mhm.
It's some work, but
It's scary,
it's worth it.
but it's worth it.
All right, sounds good. And we'll talk to you next week.
Hopefully I'll be back soon.
That fun, I guess.